doors closing.
If you look at life expectancy in the Loop, it's 85.
But you go down the blue line 3 stops past Rush, and life expectancy in Garfield Park plummets to 69. And in that short distance between the Loop and Garfield Park area, you have this great gap, 16 years.
When in time was the average life expectancy 69 in the United States? And it's almost like one is going back in time when you look at healthcare availability. I know that some will look at this and think it's all violence. It's just not all violence at all. It's cancer outcomes, it's heart disease outcomes, it's infant mortality from causes unrelated to violence. It's all of these other things.
Our community programs, which have been really fantastic in many ways, were never designed to move the dial on something like life expectancy. And last year, our leadership and our board put community health and economic vitality as a strategy of Rush.
I think that when you are ambitious and you kind of call out the systemic things that cause poor health outcomes and you say that they're structural things, then you got to step up to the plate as an institution to find solutions. But I think you also recognize that you can't fix the whole problem by yourself.
And as an anchor institution, partnered with other anchor institutions in the city, we've taken a whole new approach to health, and we call this the Total Health Collaborative. We have to be cautious coming in as big institutions and listen to the voice of the community.
We don't have all the answers. This is an opportunity for you all to tell us what's really happening.
These kids, they need more programs.
The programs that are in the area, a lot of people are not aware of them.
Community gardens, that would help a lot with like family bonding, healthy eating.
Just as I read this, I got excited. I was like, this would be awesome to be able to provide.
Chicago is one of the few bastions where you have ethnically divided neighborhoods.
It's not about just me and my family. It's about all of us.
We should come together as a community.
And then do what?
Work together, collaborate.
Like, make it easier for us to find a job, even if it's like making easy money. It's better than making like bad money, like by selling drugs and stuff.
And the businesses is what we're missing.
We need more resources.
There's nothing left for them to hang out on the street.
I think it's a great idea. This is one of the things that in our church is basically what we're doing. We're about the community.
I don't want the work that I put in to just stop because I'm no longer there. So then that's why I try to delegate out. So then I would make sure, okay, this is your charge. I'm passing the light on to you.
How are we really going to progress monitor? And what do the check-ins look like to see that we are really on the same page and moving toward the same direction?
Let the children in your community know that they're not alone.
I think we still have to reach out to the organizations in the community, invite them in and say, you know, we see you're doing some good work. What can we do to help you?
Another thing I like about the West Side is the many parks.
What I like about my community is the playground.
The library.
Any given night in the summer you can hear like the mariachi bands outside in someone's backyard.
And one thing I love about my community is the youth centers.
My school.
The people.
So if this program is going to be successful, there needs to be financial investment as well as a movable presence.
We'll need the other institutions in the city, the community groups engaged, and the citywide not-for-profits that are dealing with social and structural determinants of health, all together with the city of Chicago to build health and economic vitality on the West Side.